had its previous surge in September when they were having about 90,000 cases per day at its peak. And at that time, everybody was very concerned in a country that's so populated, that's so dense, could we have an overwhelming of the healthcare system? Now, at that time, there was a number of strategies instituted. I have friends and family in India as I'm of Indian background. And one of the things they noted was that masking and social distancing was really enforced at the local level by, it was really a community effort. And when there were lockdowns, there was a lot of different people working to make sure that the very poor were supported. And so we saw a rapid decline in the cases at that time. People were also wondering, could it be that there was a lot of undetected cases with a slightly younger population? And so was there areas that may have started to get herd immunity earlier on? Well, now we're seeing that the virus is spreading exponentially again.
And we did see that for some countries that had perhaps lower numbers in the beginning, some complacency. But what's driving this recent surge in cases in India?
I think it's a multifactorial situation as it has been in most places of the world. So when you have a combination of people starting to loosen some of the non-pharmaceutical interventions, such as social distancing and masking, when you have more people socializing and in a very highly dense place, then you will expect to see spread, especially when you don't have high rates of vaccination. There could be contribution. We know that there are some areas where the B.1.1.7 variant from the UK is widely dominant in parts of India, and then there's also the B.1.6.1.7, which is also starting to be seen, and both of those are thought to be more transmissible than the previously dominant variant. So I think it's a combination of multiple different things.
And so how much do we know about what's happening with new variants now, and how does pandemic fatigue factor into this second wave?
Yeah, so in terms of the variants, it's really dependent on a country's genomic sequencing. As you know, in the U.S., we were very limited in this, and we really are trying to amp that up. In India, there is a lot of good potential to be doing this well, but I think that right now the healthcare system is completely overwhelmed, and so there are other sort of more urgent priorities. But the whole world is watching to see what comes out and what we can understand about the variant from India, because as we know, with globalization, this is going to spread to other places. It probably already has started to do that. So we're definitely concerned. Now, in terms of people loosening some of their personal behaviors, that will play a role as well. But remember, this is a combination of individual actions and government support.
And obviously, our precious healthcare frontline workers, we're seeing some dwindling availability of staff, medical equipment, hospital beds, and of course, oxygen. How much pressure is all this putting on the healthcare system in India?
It is just on the brink of collapsing, right? It's already collapsing in some places. We're seeing videos of patients that are outside, can't get into the hospital. We have a death count that is probably a large undercount. There are likely people that are dying at home or that are not making it into a hospital bed. This is really concerning. And when you have exponential spread, again, every day is so much worse than the last day. I mean, this is really a catastrophe right now.
So then how is the government responding, and what more needs to be done to combat the virus and the pressure on these health systems?
Well, one of the things is, as has been noted, Prime Minister Modi is still sort of focused in some ways on his election and doing different rallies and whatnot. I think that the focus entirely needs to be on controlling the pandemic right now. So that's one key thing. The other thing, though, is that a lot of countries need to be helping. This is a pandemic. This is not just each country on its own. And so in India, there have been noted supply shortages of oxygen, as you mentioned, other critical care supply shortages, and also for the vaccines, to really drive up vaccine manufacturing. There are certain things that need to be sent over, supplies, and there have been export bans on some of those from wealthy countries. So there's a lot that still can be done. We need to help urgently.
Now, in terms of vaccines, India produces Covishield, which is the Oxford-AstraZeneca vaccine, and there's also the homegrown vaccine, Covaxin, and then you have Russia's Sputnik V, which has been approved for emergency use. But in terms of what's available to the Indian public, where does the overall vaccine option stand, and as well as distribution efforts?
Yeah, I mean, at this point, I know that the Indian government is expanding access. So before it was slightly older age group, now it's opening to people in younger age groups as well. But one thing to remember is that when you're in a critical surge like this, you're not going to be able to vaccinate your way out. You need a circuit breaker event to immediately and urgently curb the spread. Vaccinations are, of course, important. They're critically important. And the more people that get vaccinated, we know vaccines both stop severe infection in patients and also can reduce the chance that they transmit onwards. So we know vaccines are critical, but India is at a point now where they are surging so heavily that the focus needs to be on saving as many lives as possible and urgently slowing the spread. And so I think that lockdowns, while they have harms, external harms, we know what those are. We can predict those. We need to support people, but we need a circuit breaker.
So then if, as you mentioned, at least at this point, vaccines aren't going to be sort of that one-shot solution, what do you think it's going to take to really turn things around for India?
Yeah, I mean, I think that it's going to have to be locking down in places where there's high rates of spread, and also creating systems by which we can get patients into, different centers that can be set up. Like we had field hospitals set up in a lot of different places if there's shortages of hospital beds. So the two things that you need to do is save people's lives, make sure the healthcare system doesn't collapse on you. And the second thing is urgently stop spread. And we know spread happens in indoor, crowded, dense settings, and also in outdoor settings if it's extremely crowded, like we're seeing at the Ganges River. Those are risks of super spreading events right there. Those must be stopped right now. We just cannot afford to let those continue on.